So, Auzu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Well, first of all, Dr. Malik, thank you for the kind introduction. We are in an unprecedented era of medicine. We have done a lot of advancement in the healthcare, especially improving the health of mankind. The gym membership is all-time high. Everybody is concerned about the weight and the health implications. And yet, despite all that, we see that the epidemic of obesity is all-time high. And I will explain that this is not the obvious obesity that we see, but rather obesity that's internal as well, that causes far more damage to the human body that we can ever imagine. Next slide, please. So my first slide is a message to my all audience today. And that message is that our people, our population in the United States here, especially, worldwide to lesser degree, but here is being attacked practically by two large industries. See that? Food industry on one side, and on the other side, pharmaceutical industry, which claims that food industry creates problems for the mankind and we create drugs. Of course, the drugs that are very expensive, they create that. And we are right in the center there, right in the center. Physicians trying to help, or healthcare providers trying to help our patients. And that is a very difficult problem. Now, my talk today is about metabolic syndrome, and I have written them all in one succession. Why? Because they're all linked. Metabolic syndrome is in reality, insulin resistance, and that in reality comes from obesity, whether that is internal or whether that is external and internal together. And I will explain that further once we go up in the slide. Next slide, please. So it will be astonishing for you to know that 80% of the US population, that is a data about 10 years old, it is now somewhere 93% of the US population is metabolically unhealthy. Meaning that leaves only 7% roughly that is healthy. 30% of the total US population is obese. However, let's remember that 20% of this obese population is metabolically healthy. They look obese, but they are metabolically healthy, and we call them MHO, metabolically healthy obese. And yet, 40% of the normal weight patients that are walking today in the United States are metabolically unhealthy. They look thin, they look fit, and we call them TOFI, thin from outside and fat inside. And ironically, the population of healthy weight population far exceeds that of obese, and yet the healthy looking people continue to blame the obese people for the problems that healthcare industry suffers today. Next slide. Oh, I can click. This side is going forward. Okay. So, metabolic syndrome, which is a general term, is the cause of 75% of the healthcare problems today. 75. It actually starts with insulin resistance, meaning insulin is a hormone that our pancreas produces in response to the food, certain foods. And when it comes out, its job in the bloodstream is to drop the glucose, get the glucose absorbed by the cells so that the glucose could be utilized for the energy purposes. And when that does not happen, that is called, in general term, insulin resistance. So insulin resistance suffering population is in reality TOFI plus MUO. So thin from outside, fat inside, and metabolically unhealthy obese people. That is the combination of these two that makes up that 93% of the US population. So once that we understand, we go forward now. Now, how do we diagnose this? How do we know that we have that condition? Everybody asks that question. And there is a poor man's test that can be done technically without even going to the physician's office. And that is doing a waist circumference, not where the belt goes, but right above the navel, approximately. And if you are measuring over 35 inches for women, and if you are measuring over 40 inches for male, you have at least a threat or one component of the metabolic syndrome, and that is sign of internal obesity, the obesity around the organs, which is far more dangerous because that produces inflammatory cytokines throughout the body, and that causes further worsening of the insulin resistance. And we have an old formula that still insurance companies want us to continue to observe, which is, of course, outdated, doesn't make any sense, and that is body mass index over 30. That will make Arnold Schwarzenegger, who was one of those bodybuilders, an obese person when everybody knew he had a lot of muscle bulk, and he always was over 30. So I, in my clinical practice, do not follow this, but I have to put it because insurance companies want us to put it. And we are doing nowadays another measurement which directly indicates insulin resistance, and that is body fat index, BFI, which should be 25% of your body weight or under. If you are doing over that, there is a problem, and that's based on that we calculate total body fat calories. As you know, 1 gram of fat carries 9 and the calories, and 1 unit of the glucose has 4, and proteins have 4. So that's where we stand. So when I say the fat, we calculate the fat, it is not an inert organ, not an inert area. It is for the energy usage for the future that nature has created for us to utilize at the time when the body needs it. But the problem in America and worldwide nowadays is that we never give a chance for that fat to burn, which creates out of the regular food that we consume every day. These are some telltale signs of the metabolic syndrome commonly seen in people and gets ignored. They go to physician, they get treated for onychomycosis or the tinea pedis. Nobody pays attention to do an A1C and check on the, or put a CGM to see what's glucose doing. The other is very common also, skin tags. People ignore it. Some people go to their doctors and they want them removed, but hardly it gets noticed that this might be a sign of excess skin growth under the influence of insulin resistance. And acanthosis nigricans, an old known term that we have seen throughout our medical career, dark skin, thick skin, particularly around the neck and the armpits and other skin folds. And back of the tongue gets thickened, and that is macroglossia. That is one of the contributing factors for the sleep apnea, which can further worsen the cardiovascular disease and insulin resistance. So I'm not going to read all of them, but these are all the effects of metabolic syndrome. Look at this. 75% of healthcare problems today attributed to this. If we could fix it, we could work, we could help a lot of humanity, not only in this country, but throughout the world. Why? Because this kind of processed food that is mainly responsible for this problem is now seen in all other countries. This is the effect of America and the capitalism that has taken all these processed foods to worldwide, and you have now, you see in Arab countries, everywhere, these fast food chains that are open, creating havoc to the human health, and nobody's paying attention to it. Now, because of the time constraints, I'm going to continue to come towards wrapping this talk. Of course, this is a very vast subject, a subject that should nearly take 12 hours, in my opinion. It is between 12 to 15 minutes, cannot be resolved, but we have to find solutions. And that is what has been my struggle for last 5 to 6 years, that I said, I have more diabetic patients than an endocrinologist in my town, almost 4,000 to 5,000 patients, and all of them were getting big, getting obese, not getting better, cardiovascular health catastrophes all the time seeing, and helplessly sitting writing those prescriptions, not knowing what to do, because that's what the guidelines were showing. And something had to occur, and then search into this field led me to believe there is a solution. It is a hard solution, but it has to be tackled. And the nature has already told us that solution. The problem is we are unwilling to take heed to that and continue to see the consequences of this. And you know why? Because majority of these processed foods have an addiction element, because they deliberately put fructose and sugar, and that compound is as addictive as cocaine and heroin. The only thing is that the sugar and the alcohol is socially acceptable, but the sugar, in the case of a sugar, because of its socially acceptable, nobody says that this is an addictive behavior. People say, oh, I have a sweet tooth. Well, when they do, then that's a real problem. Now, I want to take you to this simple picture that I once saw in a journal, and I liked it so much because it gives you a whole story of my talk today. Whole story. This is what food industry has done to us to morally equalize these two things that you see on your screen today. Eat a donut. Hey, calories are calories, no matter where they come from. That's the concept. The problem is human body is not a calorimeter. Human body works with hormones in response to what we consume. And those hormones decide where that food eventually goes, whether that goes for ATP synthesis, which it should be on the majority of the time, and not for fat deposits. That's where they have been successful in convincing the population that all calories are created equal when they are not. And that's what we have to convey to our patients today. You have an apple that came from a tree. You can make an apple pie. That's not a real food. And a change of a mind is needed to curb this situation, or else we will continue to go into this trouble. Now, our cells are the eventual recipients of what we consume. They are the mini of us, I should say, mini me. And every cell, their needs can be met with these food items that I've written there. They're all needed for our food. And guess what? Tell me how many processed foods have these. They have been stripped because that's the only way they can increase the shelf life. Strip the fiber, strip good proteins. They cannot keep them on, the real foods. And the animosity towards healthy food, since Ansel Keys' study came out, where he sold basically his soul and told us that we should go on high carb and low fat diet. And ever since that, from the 80s, we have seen the explosion of the healthcare, dollars being spent on cardiovascular disease, heart attacks, those type of things. Hey, we have to go back to the basics. And the basics, by the way, was taught 1400 years ago by the Holy Prophet ﷺ, by the direct guidance of God. But yet, we find that despite having the knowledge, we are not able to capture the essence of the message, unfortunately. And it's high time that we do, and convince the world that listens to us that, look, the solution was provided so many years ago. One of them is fasting. Allah in Holy Quran said 1400 years ago, fasting is good for you if you only knew. By the way, 12 hours of a fasting, where you, in this particular case that I'm talking about, intermittent fasting, where water is allowed, 12 hours of your precious time, your body is certainly consuming without a difficulty all the glucose that you have consumed. Okay, all of it. And then after 12-hour mark, the fat burning actually starts. That is why fasting is the key and the central element to reversing the metabolic syndrome. Second, giving our bodies enough rest to avoid the attack of cortisol, at least 6 to 7 hours of good sleep. Third, doing musculoskeletal exercises to trigger those muscles that have been squeezed out of life by the high fat percentage, so that they could start burning glucose efficiently, and we could see them in real time on the CGM, by the way. We could see it. Nowadays we have the technology that could let us know what's happening. If your muscles are up and running, you'll see how good they respond. And going back to high and good protein, good fats, and carbohydrates that are only present naturally in fruits and vegetables will 90% of the time eliminate this problem. In other case, we would have to utilize GLP drugs, which would have been the next talk, by the way, where we could see how GLPs can help us reverse the metabolic disorder and get us towards a better state of health. Jazakallah for your attention.